Hi, this is Dr. Paul, and these are the instructions that I want you to follow to start your protocol for field control therapy. I want you to start it within 7 days of getting the protocol from me. Do not do any other treatments like massage while you're on the protocol, and don't do anything for 1 week after because you may get a relapse of your symptoms if you do. Okay? The other thing I want you to do is make sure that you go through the entire protocol once, unless I tell you otherwise. There's some additional notes underneath the protocol sheet. Okay, so if you go right through here under the time of day that you're taking the vials and which vial to take, there's usually a set of instructions that in your paper it'll be lighter than black because it's in red actually, but I have a black and white printer. So just follow those instructions after you finish the protocol. And next thing I want you to do is from each of the vials, only take one droplet and place it under your tongue for 10 seconds and then swallow before moving to the next instruction. Always to make sure that you're taking a droplet in a specific time between each of the remedies. So whatever time I tell you to take it, just take it at that time. If you miss one, don't fret. Just extend the time. If, for example, you're an hour late or 15 minutes late and you need to take the next one at 4 o'clock, just extend it to 4:15 because you were 15 minutes late. Don't touch the dropper to your mouth or your hand. Try to just leave the dropper clean because it can contaminate it. Don't put anything in your mouth for 5 minutes before and after each drop. If you accidentally take more than the prescribed droplets, don't worry. No harm or problems will result. All your body needs is one single droplet. There's more power in a single droplet than in multiple drops. So less is better. If you accidentally take a whole dropper full, then it can negate it. So just be careful. You won't get hurt if you accidentally take more, but it can negate the protocol. Try to start the protocol in the morning if you can, unless you have a really short one. Don't interrupt your sleep while you're taking the protocol. If you need to go on to the next day for the same vial, that's fine. Don't forget to bring back the vials because we charge $10 for each vial if you don't return them to recycle them. While you're on the protocol, try to avoid electromagnetic fields as much as possible, like televisions, computers, microwaves, electrical tools, etc., etc. Make sure you read through this because you want to avoid them as much as possible, and even when there are TVs and computers in the adjacent rooms. You mainly need to avoid them while you're doing the protocol unless I say so. For someone that's really sensitive to EMFs, like certain kids with autism, then you may need to avoid it for a longer term. Try to keep your devices at least 15 feet from your sleeping bed, and if you can unplug it, that would be even better. Try to turn off your wireless internet throughout the day if you can. I know that's kind of hard, but I try to plug in everything, and there's no Wi-Fi for my household at night. But I'm on when I instruct my patients, they need to make sure that they turn off their wireless as much as possible, but especially during sleep. Battery-powered alarm clocks are okay. And this may sound extreme, but like I said, everyone has different sensitivity to EMFs, which can interfere with the response to the vials. Therefore, these instructions are meant to safeguard the most sensitive patient. So with regard to diet, I want you to follow as much of a low sugar, low carb diet as much as possible with minimal grains. Each meal should include 80% protein, vegetables, and or good fat, like not vegetable fat, but things like coconut oil. You can do cold, not heated olive oil. You can do, sauteing of olive oil, but I cook a lot with coconut oil or low heat grapeseed oil and also olive oil. But you can have butter also. Make sure that you drink plenty of water. Back to the diet, and 80% of your, like I said, of your diet should be protein, vegetables, or fat, and 20% from starches and sugar. Make sure you drink plenty of water, half of your body weight in ounces, so you can flush toxins through your kidneys and help minimize detoxification reactions. There is a chance you may get a detoxification reaction, so it's good because you're releasing toxins from your body. I'm trying to minimize that as much as possible, but if you do get it, it's because you're trying to release toxins. Be patient, and it may take numerous weeks to notice any effects from one round of treatment. It's normal to, like I talked about, to see a healing response because the body's getting rid of stuff. It may take several months before you start seeing significant changes in your health, since we're going after the deepest toxins first. So a couple other things just to mention. Make sure that until instructed otherwise, I already went through that. I went through that already. If you are aware of any toxic home or work environment, please talk to me about that, because we may need to have you avoid those. If you are on any prescription drugs, please be aware that as you get better, the amounts of the drugs may change. So you please stay in touch with your medical doctor so you can adjust dosages. Get to sleep by 11. Try to get at least 7 hours of deep sleep. And the rest of the information is things about the vials, what's inside the vials. So if you have any questions, feel free to call my office. My name is Dr. Paul, and looking forward to seeing you soon.